Good evening and Jai Shri Krishna everyone. I'm Divya Tripathi, one of co-founder and program manager FOGA USA. On behalf of Federation of Gujarati Association of USA, which we call as the FOGA USA, and the Health Committee of FOGA USA, we welcome you all in today's our health seminar. FOGA USA, a platform of the United Voice of Gujaratis living in USA. એની વધુ માહિતી આપણા પ્રેસિડેન્ટ ફોગા યુએસએ ના વાસુદેવભાઈ દ્વારા માહિતી આપને પ્રાપ્ત થશે. Thank you so much, first of all, for joining today, including all the participants, leaders, all organizations throughout the USA and also from India. Just so you all know, this program is recording. આ program record થઈ રહ્યો છે, just for તમારી જાણ માટે. Hope you and your family are doing well. અમારી હેલ્થ કમિટી જે ફોગા યુએસએ ની છે એને ડિસાઇડ કર્યું કે ઓર્ગેનાઇઝ ધીસ કાઇન્ડ ઓફ ધ હેલ્થ સેમિનાર to understand and achieve the successful aging. And in future, upcoming time, we will continue to do the health seminar on various different topics. આજનો અમારો જે ટોપિક છે એ છે mental health. We all know COVID પછી everyone's life changed in either way, so many ways. So it's very important to be a stronger or mental condition with also physical. Today we'll provide you very useful information by our expert and very knowledgeable doctor speaker. Our purpose is education and to create awareness to the community. We have our FOGA USA Medical Committee Chair, Dr. Himanshu Bhai Pandya is here. Today is our seminar moderator for today's seminar is Dr. Tushar Bhai Patel. And our speakers are Dr. Vasudev Bhai Makhija, Dr. Amish Shah, and Dr. Nehal Sukla. FOGA USA, thanks to SAMHIN for collaborating with us. Thank you, SAMHIN. Thank you so much, all the doctors, FOGA USA Medical Committee, and all the associate various organizations of the USA. જેને કોઈ પણ પ્રશ્ન હોય આ ટોપિક ને લગતો તમે ચેટમાં તમે મૂકી શકો છો અથવા જો તમારે તમારું નામ ના કહેવું હોય અને એનોનિમસ તરીકે મોકલવું હોય તો તમે મને મોકલી શકો છો કાં તો તુષાર ભાઈ જે ડોક્ટર છે તુષાર એમને પણ ડાયરેક્ટ પર્સનલી મોકલી શકો છો અને we are not going to say your name but just read your question and you get the answer from the doctors. અને at the end of the program જેને ઓપનલી કોઈને કંઈ પ્રશ્ન પણ હોય so please raise your hand and one by one we put you on the screen and the doctor will give you your answer if you have any question. So before we start our health seminar today, let me invite our FOGA USA founder, Dr. Vasudev Bhai Patel. He's in India right now. It's almost like 4:30 in the morning. Everyone know he was a president of Gujarati Samaj of Atlanta for 4 terms and currently he's president of FOGA USA. So let me just Vasudev Bhai.
Good evening and good morning for me. It's 5 o'clock exactly now.
Right.
In India. I really thank you Tushar Bhai and Himanshu Bhai to helping this wonderful and very important subject of under the mental health, and particularly the subject is the understanding and achieving successful aging, and that is all need that subject actually. Everybody has to understand how you live successfully while you are getting older and older. Let me just say something little bit about the why we have started or uniting the Gujaratis. In the USA, there are more than 57 Gujarati Samaj itself individually working, as well as there are about 12 plus caste bases like Swaraj Patidar Samaj, Charodhar Patidar Samaj, extra as extras. There are plus some religious associations. So we are more than 80-85 associations are independently so far so working very successfully, very powerfully. But we do not have any one platform for the voice. Wherever we have to go somewhere or discuss something, generally they talk about not individually, but with the platform very effectively you can make the dialogues with someone. And that was a idea, we got it. And initially, me, Pakaji, PV Patel, then our young team, Divesh Bhai, Chirag Bhai, and Jamin Upadhyay, we joined. That's why we call us as the founders, basically. Then we have about more than 70 plus association join as we contact everybody. And everybody like these ideas. Basically, it is helping hand to each and everyone in a that is a part of this medical session is also going on. In August, please save the date. August 2nd, 3rd, and 4th, we are doing the first Gujarati convention. And that is the first time happening. We are different from Chalo Gujarat or those kind of events because that is a particularly cultural base and only New Jersey base. But here we are inviting all the associations to get together and do the one platform, one voice, United Gujarati. That is our theme. And we are doing in Dallas, Texas. It's a 3-day event, basically, Friday, Saturday, and Sunday. It will be the mixture of knowledge. We will do the business to business also in that one. Also, we are planning to do the matrimonial also, which is one of the very burning point for the first generation who came in early days. So I invite everybody, please save the date. Soon we will send the link, how to participate, how to the hotel reservation and everything. And I invite again everybody to come. I don't want to take too much time. I will invite Dr. Tushar Bhai Patel to continue with the seminar. So we save the time effectively. Tushar Bhai?
Thank you. Thank you, Vasudev Bhai. Before we bring it to Sarvi, let me just give me 1 second. So let me just invite now Dr. Himanshu Pandya, who is our chair for Health Committee FOGA USA. Himanshu Bhai is located in New York and he is currently a regional director of API, New York. He is a board of directors of New York City Health plus Hospital Corporation Gotham Health. And New York City HHC Gotham Health is the nation's largest federally qualified health centers. So thank you so much, Himanshu Bhai.
Thank you, Divyesh Bhai. Thank you, Vasudev Bhai. FOGA USA અત્યારે આપણા માટે ઘણા બધા સેમિનારનો પ્લાન કરી રહી છે અને જ્યારે અમે નક્કી કર્યું ત્યારે એવું લાગ્યું કે મેન્ટલ હેલ્થની પ્રાયોરિટી વધારે છે એટલે શરૂઆત એ કરી. થેન્ક્સ ટુ તુષારભાઈ કારણ કે બધા સ્પીકરોનું ઓર્ગેનાઇઝ કરવાથી લઈ અને ગુડ સ્પીકર he was able to get it. એટલે થેન્ક યુ ટુ ઓલ 3 સ્પીકર્સ. તુષારભાઈનો બ્રીફ ઇન્ટ્રોડક્શન કે એ પ્રેસિડેન્ટ ઓફ હેલ્થ કેમ્પ ઓફ ન્યૂ જર્સી, a non-profit that provide health screening and disease prevention via health fair for uninsured and underinsured individuals in New Jersey for the past 25 years. એટલે એ પોતે એક non-profit organization ચલાવે છે, ન્યૂ જર્સીમાં હેલ્થ કેમ્પ કરે છે અને 25 વર્ષથી આ એમનું કામ ચાલુ છે. અને આ ઓર્ગેનાઇઝેશન એમની સર્વિસીસ ખાલી હેલ્થ સ્ક્રીનિંગ સુધી નથી પણ એ લોકો કમ્યુનિટી હેલ્થ સેન્ટર ન્યૂ જર્સી થ્રુ પણ આપણા સાઉથ એશિયન કમ્યુનિટી, ઇન્ડિયન કમ્યુનિટીને હેલ્પ કરે છે. અને એ જે કમ્યુનિટી પાસે હેલ્થ ઇન્સ્યોરન્સ ના હોય કે જે હેલ્થ કેરમાં એ લોકો પાસે એક્સેસ ના હોય એ લોકોને બહુ હેલ્પ કરે છે. અને જ્યારે મેં એમના નંબર્સ જોયા કે લાસ્ટ 25 યર્સમાં તો આ ઓર્ગેનાઇઝેશને મોર દેન 12,500 સ્ક્રીનિંગ કરેલા છે. એ ખરેખર બહુ જ અગત્યની વાત છે, આપણા બધા માટે ગૌરવની વાત છે જે એમણે કામ કર્યું છે. અને મોર દેન 4,000 ક્રોનિક ડિસીઝ એ લોકોએ ડાયગ્નોઝ કરેલા. એટલે આ બહુ જ અગત્યની વસ્તુ છે આપણા બધાના માટે. અને તુષારભાઈ, thank you so much for doing this one and welcome to the FOGA USA for handling this seminar.
Thank you so much, Dr. Himanshu Pandya and the entire FOGA USA team for your time and efforts in promoting the wellness, promoting the well-being, health for our South Asians, especially people living in the United States. Welcome to Mental Health Seminar. The topic for today is Understanding and Achieving Successful Aging. We have three distinguished speakers, mental health professionals with us this evening. I'm going to start introducing them one by one. First one is Dr. Vasudev Makhija. Dr. Makhija is a New Jersey psychiatrist, distinguished life fellow of the American Psychiatric Association and past president of New Jersey Psychiatric Association. He is the founder and president of SAMHIN, South Asian Mental Health Initiative and Network, a non-profit organization devoted to addressing a broad range of mental health needs of South Asians in the United States. SAMHIN was a recipient of the American Psychiatric Association Foundation's 2023 award for the advancement of minority mental health. I'm so fortunate that SAMHIN has partnered with Health Camp of New Jersey for more than a decade to bring mental health services at the health fairs in New Jersey, and is available through helpline for those in need. They offer a variety of programs, including 4 free regular support groups. If you want to get more information about their program and initiatives, please visit their website at samhin.org. Our next speaker is Dr. Ami Shah. Dr. Shah is a second-generation South Asian and Gujarati clinical psychologist born in New Jersey and currently practicing in New York. Having been raised in the community with elderly family members from a young age, she became intrigued to explore what factors contribute to feelings of hopefulness as we grow older while experiencing various life challenges and losses as we all go through. In practice, she is passionate about treating adults and older adults. She is curious to learn more from each of you today what healthy aging looks or feels like within our South Asian community. And the last speaker, last but not the least, Dr. Nehal Shukla. She is specialized in family medicine with a focus on geriatrics, older age population. She has experience working with the older population. She works with the prestigious Northwell Health System at the Northwell Academic Campus Nursing Home in Manhasset, New York. So before we start the discussion, I would just like to give a little background of aging. So aging is a period in life cycle experienced by everyone. We all go through the aging. We grow older and older every single day. The world population is aging rapidly, with the global proportion of people aged 60 and over will reach from 11% in 2006 to 22% in 2050. In 2050, the world's elderly population is estimated to be multiplied by children under the age of 5, and in the next 50 years, the elderly population will reach 2 billion worldwide and is estimated to face a sudden increase in the elderly population between 23 and 2040. According to UN definition, when a population over 60 years old reaches beyond 7% in a country, that country is considered to be aged. So by knowing these facts, I'm going to start with a question for Dr. Makhija. Can you explain what is successful aging? Dr. Makhija,
I have to unmute, yeah. That in a few years, I'll have a lot of company.
Yes.
As the population ages. So in psychology and psychiatry, we are trained to uncover and treat diseases like any medical field. And when we talk about successful aging, we are talking about the aging of normal people and not a disease. So aging is not a disease that we can fix with a pill. I learned more about this from others who share their experiences with me. than from the books and journals that I read. And before the hour ends, I hope there will be time for the moderator to allow some people from the audience to share their experiences, because I believe truly that each of us has an inner creative potential to weather life's storms. Successful aging is a relatively new science and concept. It is not just about living longer. I mean, with medical science, we are all living longer. People live longer. But who wants to live to 90 if they experience Alzheimer's disease, are unable to function, or are stuck in a forgotten state in some nursing home for a few years? So successful aging has to be defined differently than just living longer. So there have been many experts who have been researching this and trying to define this concept. And they have come up with many definitions, but I'll share some of the things with you. Some experts say that successful aging is freedom from disease and disability, and having high cognitive and physical functioning. By cognitive functioning, I mean the way we perceive things, by our ability to reason, judging, imagining, planning, understanding. Other experts say that the ability to adapt to losses determines successful aging. All experts agree on the importance of physical functioning and freedom from disability in successful aging. We cannot wish truly for the complete absence of disability as we age. That is inevitable. Success in late life depends on our success in managing these disabilities.
Thank you, Dr. Makhija, for defining the successful aging. I'm going to ask next question to Dr. Shah. Dr. Shah, can you explain what types of losses do we experience as we age? And also, can you discuss coping with these losses? We all go through this in our normal life.
Yes. So, okay. So when it comes to losses, there's two major types. And is it echoing?
No, you're good.
Okay, can you hear now?
Yes.
Okay. So when it comes to losses, there's two types of major losses we may experience as we age. The first one is the anticipation of loss, and then the other part of it is the actual loss itself. And so the anticipation of a loss, I think the word loss is something that we should think about as also thinking about adjusting to a major change in our life. So for example, if someone needs to retire early or unexpectedly, I think one big adjustment that could also be perceived as a loss as we age, which I know Dr. Shukla and I see a lot in practice, is a loss of physical independence and what that means in terms of quality of life and how to adjust to that. So some things that commonly may come up for a lot of folks is some of the early stages, for example, developing physical conditions such as arthritis, then going from that to using a walker or a cane to being wheelchair bound, and in some cases being bed bound. And so I think when it comes to this, the thing to think about is there's different stages of grief. I think when we typically think of grief, we think about someone actually passing away. However, I think loss is something that can occur really at any different stage of life. But especially as we age, the physical part is something that we see quite a bit in practice, and the anticipation of it. So for example, like Dr. Makija talked about, the cognitive, so meaning your mind is working, but your body, in some ways, I had someone describe it as my mind is working, but my body is betraying me. And so I think that's something that to adjust to is how do I cope with these physical changes, even when my mind is still working? And I think another big component is, you know, if you do choose to retire at a certain age, what do I do with that time? Which may not necessarily feel like a loss for some, but for others who are so used to a busy lifestyle, a lot of folks have shared, well, what do I do with this time? I've been I've been in this trade, I've been a lawyer or, you know, a nurse or whatever it is for many years, and now what? And so it's trying to redefine a sense of purpose in life. And so I think when it comes to certain types of losses, depending on the context, I think one of the biggest things is acknowledging that there will be maybe different stages of what feels like grief. And so maybe if it's an unexpected loss, you might experience shock or denial. In the traditional sense, if someone passes away, sadly, there is a shock or denial. Even if the person was ill for some time, there's still that shock or denial. How do we cope with that? So a lot of times it's just working through and allowing yourself to experience the pain in that moment, and even years later. So I've worked with people who have lost loved ones, even, you know, throughout the years, and especially since we've experienced COVID. And so now I think the biggest thing is recognizing and normalizing the pain as part of the experience. And because the more we avoid it, it just becomes harder later on, can really affect our mood later. So acknowledging the pain helps to work through it, the different stages of loss. Sometimes you might feel anger, sometimes you might feel upset, sometimes you're perfectly fine. And so just if you allow yourself to work through the different emotions, it can really help to cope with the losses, regardless of the context. And I think, of course, being South Asian, what we all know is having a good community support, which we'll talk about a bit later as well. And I think also a big part of it too, which might be a bit challenging sometimes because we have a big family and community lens, is also being able to say no. So maybe after a significant loss, allowing yourself to say, I'm sorry, I cannot attend this party on Friday, and I will do my best to be there next time. Just allowing yourself the space and time to heal.
So, so adjusting with the lifestyle, I think that is the key. When you grow older, with your losses, with like changes in your life, retirement or medical illness or loss of a family or something in that nature, adjusting is very, very important. Yeah. So Dr. Makija, what can people do to achieve successful aging? You defined the successful aging. Now, can you give some recommendations or ideas of what people can do to achieve that successful aging?
Yes, and actually I wanted to make one more comment, follow up to what Dr. Amy Shah said. One old person said that life is like a book. When one chapter is over, you got to move on to the next chapter. These are actually words of an old person in his 8th or 9th decade. So successful aging is immensely complex and involves interactions between our genes, our brain, the environment, and our attitudes and our beliefs. So we have good genes. We can have good genes or bad genes. The longer life is made possible by the absence of harmful genes rather than the presence of life-extending genes. We do not have control over our genes and many of the external factors that influence us. We need to focus on factors that we have control over and that we can modify. Examples are like physical activity, nutrition, mental or cognitive activities. All these also influence successful aging. And you will hear more about this throughout this program. We cannot stop the rain, but we can surely open an umbrella. And some of the things that can be done to improve the chances of successful aging are education. Research has shown that having greater educational achievement will dampen the effect of some of the genes that are harmful and that cause the decline in the cognitive function and increase the risk of Alzheimer's disease. So our parents were right in encouraging us to follow and pursue higher education. It has more than one benefit. Another thing is engaging in productive activities, whether it's volunteering, working, teaching, learning. Other activities include reading, music, singing, movies, you name it. And did you know that the income and education, actually no, just the income is minimally related to successful aging? A higher sense of purpose in life, optimism, and positive attitude toward aging are associated with longer lifespans.
Thank you, Dr. Makhija, for giving that how to achieve successful aging. So, Dr. Shah, we all are stressed on a daily basis from one reason to another reason. So can you explain what are some signs that you might be stressed? People can identify themselves that they are stressed, and please also discuss the need to ask for help when it's needed.
So this is a great question. I will do my best to cover. I know this is a very important and broad topic, and I would love to hear people's thoughts in the chat box or, at any point during the program. I think one of the biggest things to keep in mind when it comes to us being South Asian is, for many of us, and if we're talking about folks of certain generations, more typically family and family relationships and community bears a big role in terms of how we express ourselves. So for example, should I say this, or should I tell this person this, or what happens if this person finds out? And that also can play a role in if and how we decide to express what we're feeling. So I guess I have that in the background for a lot of people that can relate to that, and maybe it's not everyone. So I guess first, considering the role of our family members, whether it's our biological or whoever is a part of our environment or influences the types of decisions that we make, I think is important to consider. I know a big part of our larger culture is, to some extent, pleasing, right? And showing a certain reputation, maintaining a certain reputation, which can then affect, right, if and how we seek help. So just wanted to put that out there. But I think, one of the biggest things that I think a lot about is each of us we know ourselves best. And so the first thing is to trust your instincts, right? As intuitive as that sounds, is to trust that you know yourself best. So for example, if after a major loss, you start to notice again, going back to even the stages of grief and loss we talked about before, if after a major loss or an adjustment, whether, again, someone passes away, you anticipate someone passing away, early retirement, unexpected changes in your life, and illness for yourself or loved one, it's very normal, I guess. We want to first normalize feeling stress. And I think sometimes we, maybe even in the mental health community, might put so much emphasis on stress that the word kind of gets lost in space. So I think normalizing stress after a significant change, whether it's unexpected or expected, is normal. So if you feel like you're stressed after even a big move, again, allow yourself to experience whatever it is that you do, finding outlets. Even in the weeks to follow after a significant loss of someone, for example, allow yourself even weeks or months to sort of grieve and go through that process. I think the part, to the second part of the question is, how do I know when I need to seek help or what that looks like. So I think the main thing, again, you know yourself best, is it affecting my day-to-day life? So some of the things that I've sort of observed in time that might come up is maybe it starts to sneak into your day-to-day habits. Maybe you just forget to shower, and that's something that you do every day. Maybe you are, as you see it, oversleeping, or you're doing the opposite, you're undersleeping. So if you're someone who for 50 years has like clockwork slept for, I don't know, 8 hours, and now you find yourself, you know, perhaps having sort of up and down cycles with sleep, it's something to keep an eye on and say, is there more to this? Sometimes that stuff self-corrects. Sometimes if you notice it happening more, you're missing meetings. And the thing is it affecting your day-to-day life, your functioning, how you're doing every day? Is it affecting your food habits? You forget meals, perhaps the opposite too. I notice I'm eating more than usual. I had someone share that, you know, they were missing deadlines at work. So one of those things, if you just look at the missing deadlines, we might get upset at that person and say, how can you forget this deadline? But when you really take a look, they've had a perfect track record, and this is just something. So this is a point where they might want to say, do I need help? Is this something where I can figure out on my own, or would it be helpful for me to seek other resources? So the bottom line is normalizing after any major adjustment that there will be a number of emotions for a period of time, and then finding ways to reach for help if you feel like it's affecting your day-to-day functioning. That's the key part. In terms of how to seek help, I think it's really important to be mindful of different people's backgrounds generationally. So I know some folks where seeing someone like myself might feel very different to talk to someone who is not a family member. And so again, keeping in line with family norms, societal norms, individual norms, what do you feel like is the best way? Who is the first person you could think of that you trust and you want to talk to? So that could be a family member, it could be a friend, somebody at your local community center, your religious place of worship. Sometimes it also, if you're more of a private person, you can write down your thoughts somewhere in a safe space, in a journal, on a piece of paper, on the computer. So there's a number of ways. And then obviously in some cases, if you feel like you're comfortable, you can also talk to a mental health professional who would, of course, keep all that information confidential. Yeah.
Thank you so much, Dr. Shah. So remove the social taboo of mental health, identify the need, and ask for the help. I think that is the key right here.
Yes.
Dr. Makhija, so does mental health, specifically depression, influences successful aging, in your opinion?
First, let me clarify the word depression and differentiate it from the normal sadness that we all experience when you are faced with a loss or some other painful experiences. That is normal sadness, which does not require treatment. And depression is identified when the individual experiences certain signs and symptoms. And then Dr. Amy Shah actually went through a list of many of those symptoms nicely. So one can discuss these with the family physician who can guide you on this. When the individual has depression, additional interventions may be needed, and some may need referral to a mental health professional. Depression does adversely influence successful aging. For example, it interferes with our ability to engage in preventive interventions, for example, reduced motivation for exercise or working, or decreased social interaction, and not keeping doctor's appointments, not following their diet, and missing the medications. Therefore, when one is depressed, it should not be ignored, but managed effectively with the help. So check with your family doctor, start with that.
Thank you, Dr. Makhija. So the next question is for Dr. Shukla. Can you explain what is the role of exercise in our golden years and how does it influence successful aging?
Yes, so exercise, the topic of aging, have been researched over a very long period of time, like Dr. Makija had mentioned. It's a known fact that those who exercise tend to have a better quality of life. And regular exercise ultimately helps people age more slowly and they live a longer life. Exercise also allows a decrease in chronic medical conditions, including better control of your blood glucose, better control of your blood pressure. It also helps decrease muscle loss as we age, and it also helps prevent falls. So as we all grow older, we don't move much as we did when we were younger, and we become more sedentary. I know that from where I work in the rehab setting. You know, a lot of people with chronic medical conditions can move as well as they did in the past. And because of this lack of movement, people tend to develop more fatty tissue, and it's hard to burn off these calories. And this often leads to poor immune function, problems with circulation, and it also leads to inflammation and increased risk of developing disease. And leads to shorter lifespan. So the goal of healthy aging is to really increase physical activity earlier on in life and really making those small changes with everyday habits. Again, starting off very slow and then building up your routine is usually what helps the progression of exercise. I think the American Heart Association really recommends moderate to intense level activity from 15 minutes to 30 minutes of brisk walking. Again, it depends on your ability and your capability. You can start off slow. You can start off 15 to 30 minutes, 1 to 2 days a week, and then to build up to 4 to 5 times a week. Essentially, going to the grocery store, really walking inside your own home, walking in your basement, working in the garden, climbing stairs, little activity, and then progressively going on and developing a everyday routine is very important. When I mentioned the brisk walking, it's also considered an endurance activity or an endurance exercise. And what I mean by that is it helps improve cardiovascular function. So it gets your heart pumping, your arteries are more flexible, you're able to lower your heart rate, and then the heart is pushing all the blood and oxygen to all the body tissues. So that's a very important part of keeping the heart going and pumping and making sure that we're getting oxygen to the vital organs in our body. So I just mentioned brisk walking, but there are other types of endurance activities that you can be doing, using a stationary bike at home, doing low impact aerobic activity, just getting yourself to breathe faster, increasing your heart rate, anything that really does that. And you should try to do it to the best of your ability. It's recommended to do endurance activities up to 1 to 2 times a week. It improves sleep. It eliminates isolation, just like Dr. Shah and Dr. Makija mentioned earlier. It improves mood, reduces your risk of dementia and depression and anxiety.
Thank you so much, Dr. Shukla, for that wonderful tip. So next question is for both of you, Dr. Makija and Dr. Shukla. Are there any association between our eating habits, lifespan, and successful aging? Because there are a lot of controversy regarding the eating habits with the diets and what's happening with the diet. So can you explain what is the association between those three?
Yeah, I can go into it a little bit. Basically, we talked about exercise and physical activity being really important to healthy aging. Eating a healthy diet is also just as important in overall health and well-being. From a food standpoint, foods that are rich in healthy fats are those that help support the immune system, help in wound healing, and unhealthy fats really lead to inflammation and cardiovascular disease. So some examples of healthy fats would be like dark chocolate, chia seeds, eggs, avocados, olive oil, using olive oil in your meals, yogurt, or adding tofu, flax seeds, any sort of nuts. Those are healthy fats, and that would be something that would be recommended, versus the unhealthy fats. And I'll let Dr. Makija add to the discussion.
I'll just add one comment. There has been a research that has shown that as we get older, reducing the caloric intake may help us live longer. So watch the number of calories and the portions that you eat. Smaller, the better as you get older.
Great. Thank you both. So Dr. Shah, what is the importance of socialization as we age, and how do we cope up with the feeling of loneliness? As we grow older, we all go through the changes and we started feeling lonely. So how do we tackle that?
When I was writing my response for this question, I found that it was probably the most challenging question to talk about, just because I recognize too that there's very practical stressors involved, especially since COVID, with loneliness. So I guess kind of redefining the challenge and then going into, it a bit more. A lot of folks, I think, especially here, of course, in the States, a lot of older adults that I've met with, they very much want to be social and are met with the challenges, again, like we talked about before. Either they're homebound, transportation, they no longer are driving. The unfortunate part of living as long as you do, of most of the people in my family have sadly passed away. I'm the only remaining family member. All my friends have passed away. These are very real realities. If, any of us make it into, well into their older age group. So I think feelings of loneliness is something that I've noticed has become more and more of a thing since COVID. We, especially going from periods of really the human brain was not developed to be in extreme isolation for such periods of time. And so I think we're still recovering from that. I think one of the biggest things for us as South Asians that we need to think about is this idea of interdependence. So how can we find ways to connect with people? Because some people say, well, on the one hand, I'm seeing my family every weekend and I'm really frustrated. And then the other part, I wish I had more time to myself. And then you have the other camp saying, I have no one who was seeking me out or coming to see me. Why am I feeling so lonely? So that's, I guess, this idea of socialization, I think, is tied to this idea of interdependence, where we're able to find that sweet spot where we can say, I'd love to meet people in the community who have similar interests. And, find activities that we enjoy. I think one of the biggest challenges, so again, this is why this question was quite difficult to think about, because the adult senior centers many times are catered to folks who are older adults. And I recognize that a big gap we have in the system is for folks who are able-bodied. I think Dr. Makija was talking about earlier, and Dr. Shukla, well, how do we cope with the in-betweeners? So people that have retired for a number of reasons, say between 50 and say 70, I feel like there's a big gap in the system, because I know we talk a lot about finding a community, but I think some people get lost in the system. And so I guess part of this, is maybe one of us can start a movement here to create, some sort of traction, maybe even the Gujarati or the larger South Asian community, because I think there's a lot of lonely people out there who genuinely want to meet people, but may fall into this ambiguous category. And there's quite a number of people. And so at least to start, I would say a lot of folks who are feeling very lonely, it may seem like a small thing, but it can really help with our mood. It's just small things. Maybe it starts with a smile. So you're walking outside and you smile at someone, and maybe that creates some small talk. Small talk many times can lead to a friendship. We never know. You go to the supermarket. I know in some countries they have these special grocery stores. And again, that's catered more to older adults. I was seeing that recently, where older adults they have a special checkout line for older adults who are actually feeling lonely, and they can take their time checking out, which I think is wonderful. And I think we need to implement that here in the States for our aging folks. So, small acts, finding ways to sort of sneak in a way to speak with somebody. If you're able to leave the home, or if you're homebound, finding if you have home services, seeing if you could spend time just talking to the aide or whoever is in your home, family members. Of course, we know community activities, which we've discussed, adult day programs, like I mentioned earlier. And nowadays, there's a lot of activities, like here we are on Zoom. So they have classes on Zoom, in person, whatever works. Sometimes just making a cold call and saying, emailing someone who may have resources for something else, and somehow you might get connected to something or someone that has a similar interest to you. Like I know in New York, we're based in New York State, and there's this, I found this, it's called South Asian Council for Social Services, and they offer a number of resources in New York State. And maybe even if you're in a different state, you can email them and see if they have contacts elsewhere in your state. So maybe trying to network and put yourself out there, and hopefully that'll help a little bit of the process. But I do think part of this question is highlighting a large systemic issue we have in terms of the in-between generation of folks that we need to continue to improve.
Yeah, very well said. And also in the technological advancement right now, we can do virtual meetings, networking virtually. So I think people should take advantage of that as well. Dr. Makhija, any other comments?
Can you unmute?
I said it's hard to add anything after such a thorough, account that Dr. Amy Shah gave on this topic. I'll just add that, humans have evolved from ancestors like monkeys and apes, and just like monkeys and apes who live in social groups, we are very much social animals, and we have seen the devastation of isolation during the pandemic. Then anxiety and depression increased. So it is very important. I just, echo some of the comments that Dr. Amy Shah made.
Thank you. So, Dr. Shah, can you explain what is resilience? What role does it play in successful aging? And are people born with resilience, or is it a skill that can be learned and developed?
So one of the things that I think I think is a really great question. This idea of resilience, I think a lot about two main ideas. One is someone's willingness to change, and flexibility of how they think. So, for example, it's not so much after a major loss or a major change. Like we said, either it's an adjustment or it can equate to a loss. It's not so much about the actual loss or change as it is how we adapt to it, which is resilience. And I think that concept, I think it can be learned. I'll give a personal example of, so I'm currently have the honor of temporarily housing my 99-year-old grandfather. He's with me right now. And I think just being in that environment and just observing that, I mean, he's close to 100. So I think there's some, there's a lot of history here and a lot of experiences that he's had, including losses. He's lived through World War II. So just to give an example. So I think with that, I think a lot about what has helped him to stay mentally present. And I think a big part of that is the thought process. So finding ways, and I'm not saying this is easy, right? And I certainly think this takes a lot of, again, there's a willingness to think a certain way. It's not saying that there's not pain associated with certain life events, but it's being able to bring yourself back to the present after there's been a major change in your life. Again, whether it's unexpected health, retirement, changes, a move, an unexpected move to a different place or different state. And so I think, well, something that he says in Gujarati, so for any of the Gujarati folks here, I'm sharing, he says, Chalse bapse ne fapse, and that is the phrase that he's been using for close to 100 years. So essentially, I hope I'm translating this correctly, but, you know, anything goes, essentially. Anything goes, and he lives by that. And to me, I think that's resilience. He will eat whatever food is being put on the table. For him, as long as it's vegetarian, but that's just him. So, you know, everyone has their things, but for the most part, there's a flexibility of thought, and he lives by that. So I think I'm using that example in hopes that other folks can find what works for them. And to me, I think that's resilience. So I think it can be learned. And I think going back to what we talked about, the pandemic, it shook us up. And I think we learned how to adapt, whether we wanted to or not. And so I think the ability to adapt, maybe it takes longer for some people, but I think life circumstances present itself. So as long as we understand that there will always be some sort of pain in our life and still find value, then life is worth living. So I think that's what I think about resilience.
Thank you so much, Dr. Shah. So, Dr. Makhija, brain is a very, very important organ in our body. So, does the brain continue to adapt in old age, or does it stop at a young age?
The short answer is I have good news for you. So, you know, besides the role of genes, neuroscientists have discovered the relationship between the maintenance of cognitive health, the mental health, and as I defined earlier, ability to think, judge, perceive, reason, and the structure and function of the brain. And they have described a concept, what they call cognitive reserve. So as you enter old age, the greater the cognitive reserve you have, the longer it will take to cross that impairment threshold. So imagine a matki or matka. So if you keep taking water out of that, it'll be empty pretty quickly. But while you're taking it out, you're also putting water in. It will take longer for it to empty. So you can fill this proverbial matki of cognitive reserve if you attain a high level of education and engage in mentally stimulating occupations. Engaging in mental activities can also build cognitive reserve to delay or slow down the cognitive decline of mental capacity. So some of the examples of mental activities will like crossword puzzles or word games or anything that you do mentally, board games, chess games, that you're using your mind. However, this is not the only way towards successful aging. The aging brain recognizes there are issues in the brain and it reorganizes it to facilitate a capacity for continued learning. The brain also compensates for the deterioration that occurs when the old brain cells die. So there is some hope for all of us after all.
Yeah, and Dr. Makhija, the reason for my singing on a regular basis is to keep my brain going. So I do not develop that issues with the brain.
In fact, I had that in my mind to suggest that, you know, as some of the activities, one of them is karaoke singing, and if anybody is interested in that to talk to you, you know a thing or two about that.
Thank you. Dr. Shah, can you tell us what inspires you to keep going as you age? I am in that age category now, and how can we cultivate a sense of purpose as we grow older?
I think Dr. Makija actually had covered a lot of the things I was planning to say for that question. There was quite some overlap. So I would echo whatever he said. And I think this idea of keep going is, I think a lot about, again, with life changes, whether you're in your 70s, 80s, 90s, it's really just the number. It's about the experiences. It's where you are in your personal development. It's finding a new equilibrium. So if has been a loss or a change in your life that has really shook you up or has been really hard to adjust to, what is a new normal? And I guess that goes back to resilience. What does it look like for me to establish a new normal in my life? Maybe that means I go and spend more time with certain family members or friends. I travel. I do things that make me feel like I'm worthy or purposeful. I guess it's really going back to your personal values and finding different ways to connect with them. I think that's it. I think a lot of it was already covered, so I don't want to be repetitive.
Thank you so much, Dr. Shah. So let's bring Dr. Shukla back on. Can you tell us what kind of routine screenings are recommended for prevention and early detection of illnesses, specifically physical as well as mental?
Sure. So we talked about exercise at healthy aging. With that, hand-in-hand preventative screenings are also a vital part of maintaining good health, and starting off early and staying ahead of the health screens can set a lifetime of optimal health. I'm going to focus on the 65 and above age population because we're short on time. So the U.S. Preventative Task Force publishes recommended screenings for men and women above the age of 65. I'm just going to briefly go through them. The first one I'm going through is the blood pressure screening. Blood pressure obviously is a common condition that a lot of people have, and having an annual screening for both men and women age greater than 65 is very important. But if you have high risk of high blood pressure, so if you have cardiovascular disease, kidney disease, heart attack history, you should get screened more frequently. The next screening I will go on to is cholesterol screening. So cholesterol is what makes the body's cells, it makes the vitamins, it helps produce all the hormones in the body. There's two types of cholesterol. There's LDL, which is your bad cholesterol, and your HDL, which is your good cholesterol. Having excessive amounts of LDL and insufficient amounts of HDL can increase your risk for heart attack or stroke. Cholesterol is usually checked through a blood test. And for men and women over the age of 65 who have normal cholesterol screening should get checked every 5 years. But again, if you have risk factors, you have diabetes, heart disease, you should be screened more frequently, obviously, and seek the care of your primary care physician. The next screening I will speak of is diabetes screening. Again, after the age of 65, men and women who are in good health should be screened for diabetes every 3 years. Again, anyone who has risk factors, obesity, family history of diabetes, those are not moving as much. Women who've had gestational diabetes during their pregnancy, these folks should be screened a little bit more frequently than your average 3 years. The next screening I'm going to discuss is the lung cancer screening. I don't think a lot of people know about this screening exam. It should be performed annually, especially if you have risk factors of you're a regular smoker, you have a history of smoking for 20 years or more, or you've quit smoking in the last 15 years before the age of 65. That's an important screening to have. It's a CT of the lung. It's often missed, but it's something that you should keep your eye on. And then the next screening would be the cervical cancer screening after the age of 65. This is for women who've not had a cervical cancer diagnosis or precancerous conditions and have 3 negative pap smears within the last 10 years don't need to undergo screening. But it's also important to know that, you start off with pap smears early on in life for women, starting off at age 20, 25 and moving your way up every 3 years. And then obviously after 65, depending on your history, you get screened differently. The next screening I'm going to speak of is a breast cancer screening. So according to the American College of Obstetrics, screening mammogram starts at age 40 and it's all the way up to age 75, and should be done usually within every 1 to 2 years, depending on your risk factors. Again, if you've had history of breast cancer in the family, you've had some genetic mutation, you have dead breast, obviously you should be screened more frequently. After the age of 75 for women, it depends on your primary care provider if they think it's necessary, but there is no strong opinion on that. The next screening is the colorectal cancer screening. This is for colon cancer. I've been seeing a lot of colon cancer in the community earlier on, or even at age 40. But since we're focusing on the 65 and above, we should have patients within the age group of 65 to 75 should have a regular colon cancer screenings for both men and women. And again, if you have any risk factors, if there's any family history of colorectal cancer, if there's a polyp history, if you have a history of smoking or alcohol consumption in the family, it should be screened more frequently. The next screening I'm going to touch on is the osteoporosis screening. That's for women. Women after the age of 64 should have a bone density screen at least once annually. And it's also recommended in men after the age of 70 to get screened for osteoporosis if it runs in the family. Just a couple of things. As far as screenings, having regular eye exams is also very important as you age, because as we age, our vision is not as strong as it was when we were younger, and we tend to develop cataracts, macular degeneration, glaucoma. So it's good to ask your eye doctor to have your eyes checked routinely every year and having them dilated. Important part of your eye care. And secondly, hearing exams. One of the things that I've learned throughout my training and also what I see in everyday care at rehab, most of the patients have, about 25% of the patients, 25% of patients between the ages of 65 and 74 have some sort of disabling hearing loss, and it's treatable. So it's often just getting a hearing test at your ENT, your ears, nose, throat doctor, and audiologist. So getting a hearing test is obviously very, very important. And then just finally, important vaccinations. Just quickly run through them. After the age of 65, having your pneumococcal vaccine for pneumonia is very important. Shingles vaccine should be considered, and having your yearly flu vaccination and now COVID vaccine obviously is very important.
Thank you so much, Dr. Shukla, for that brief overview of the preventive health screening. In fact, we can have the entire segment on health screening.
Yes, I was trying to keep it as brief as possible.
Yes, we'll definitely keep that in mind for the future topics, and it's very important. That's what we have been doing with Health Camp of New Jersey for past 25 years. Prevention is the best cure. Let's bring, we got a few more minutes left. So Dr. Shah, can you discuss the importance of community, religion, and spirituality as we age? It's very, very important when we become older to bring those three things together.
Yes. So I know we're running out of time, and so I'll try to give a very brief overview of my understanding. Of course, this is another very subject that I think could take its own 1 hour. But I think this idea of community and togetherness many times ties in for some folks who identify with a particular religion or identify as spiritual. Of course, there's a lot, of course, being South Asian, we know it's very, very complicated to talk about this subject. So I won't go into specifics of that. I think one of the things that I've observed in working with older adults as well and folks, so, you know, if you fall within the 70 to 80 range, this is just a generalization. I noticed that people who are sometimes even late age and even sometimes end of life, when I've asked them, even when they know they're going to pass away, what gives you hope? It's interesting with certain generations. Many times people have identified believing in a higher power, whether or not that means God or not. And some have very directly said it is God in some form. That helps them even when they know that the end is near. So I just thought that was very interesting to kind of compare. If it helps to compare yourself depending on what age you're at, when you compare it to some folks who are in their 90s and above, many of people have identified believing in something higher than themselves. And I think Dr. Makija had touched on this before, essentially is having a higher purpose or believing in something higher than yourself. I think it's a big part of that. So I think really tying in all the things that Dr. Shukla, Dr. Makija, and everyone else has brought up is this idea of togetherness in some form or believing in something higher than yourself.
So, Dr. Makija, what about those individuals who do not believe in the existence of God?
I mean, there are many people who do not believe in God or as the Supreme Being explaining some of the answers of existence and life. And there are famous people, but many of those people can still do great things for the society. I'll give you a couple of examples. One is Salman Rushdie, the British-born novelist. It's a famous name now because of what had happened after he wrote this book on satanic verses. There were death threats on him, and in fact, he was a couple of years ago. He was actually attacked while he was giving a lecture at Columbia, and still recovering from that. The other examples are Albert Einstein, Carl Sagan, one of the famous scientist, astronomer, and these people did great work, but they also did not believe in God.
Thank you, Dr. Makija. So this concludes the official discussion of this evening's mental health seminar. I would like to invite all the speakers one at a time to just say your closing remarks, starting with Dr. Makija.
I just have two points I want to make. One about the resilience. Resilience is about bending without breaking. And there is tips that I learned when I read a book by Sheryl Sandberg, who was the CEO of Facebook. She's not with that Facebook anymore. Anyway, it's called Plan B. And I learned about 3 Ps from that. And this is a concept developed by Martin Seligman from University of Pennsylvania, who has done many years of research on happiness. So the 3 Ps are personalization. So when something happens, we say it is my fault that this happened. And we curse ourselves, we beat ourselves. Second is pervasiveness. Oh my God, belief that this will affect everything in my life. And third is the permanency, that the impact of this will last forever. So I think in our mind, we need to rephrase those 3 Ps and put it in context. That's one point I wanted to leave that thought with people. The second is a couple of reading recommendations. One is an old book. I don't know whether you can buy a new copy. It's called The View from 80. It was written by Malcolm Cowley, I think. And it's a personal account. It's a very inspiring book. And the second one is Aging Well. And this book is written by a famous psychiatrist who I've known and a lot of respect for, who's done research at Harvard. And this is it's a large book, but it's also available in audio book, and it's free with if you have Prime. And he describes the research in a simple language so people can understand. But you can also skip that part of the book. And what is inspiring in that book is that a lot of stories you will hear from normal adults that have been studied for like 60 to 80 years continuous. And you'll hear personal stories of these as they've evolved through their 6 or 7 decades of life. It's called Aging Well by George Wayland.
Thank you, Dr. Makhija. Dr. Shah, any closing remarks?
I just wanted to thank everyone for joining in on a weekday evening. I know everyone has very busy schedules and lives, and it's funny, when I first pursued working in mental health, I had realized at that time there weren't many South Asians in the community at that time, and so it's just really nice to see it come full circle and talk to people who are of a different age group. I'm very passionate in working with adults and even older adults. So it's just really nice in our Gujarati community to see all of us coming together to talk about mental health. It was one of those things in my imagination for so long, and it's nice to see it become a reality. So I just wanted to thank everyone for attending and looking forward to more of these events.
Thank you, Dr. Shah. Dr. Shukla?
Yes, so I want to thank everybody for joining us today and having us speak, myself, Dr. Shah and Dr. Makhija. I also want to thank the entire board for having us here and taking out the time from your busy schedule and allowing us some time to discuss mental health and healthy aging, which is a topic that's overlooked and often discussed but overlooked. And I appreciate that we were able to shine some light on some important things to look out for our seniors and our aging population, and things that we can take back home to our parents, grandparents, uncles, aunts, and really enforce important components of healthy aging, whether that be exercise, whether that be mood, and preventative screenings, all in all. And I thank you all for being here.
Thank you so much, everyone. And my last remarks to all my Gujarati audience is get help. જો તમને કોઈ તકલીફ હોય મેન્ટલ હેલ્થની, કારણ કે ફિઝિકલ હેલ્થ અને મેન્ટલ હેલ્થ એ સાથે સાથે જ હોય છે, અને અમુક એજ પછી તમારી ફિઝિકલ હેલ્થ કરતાં મેન્ટલ હેલ્થ ઘણી અગત્યની હોય છે. એટલે તમે જો મેન્ટલી હેલ્થી રહો તો તમારી લાઈફ બહુ સરળ રહે જીવવા માટે, અને સોશિયલી કનેક્ટેડ રહેવું જોઈએ. જો તમે બહાર જઈ શકતા હો તો દર વીકમાં મંદિરે જાઓ કે સોશિયલ ગેધરિંગમાં જાઓ. ઇટ્સ વેરી વેરી ઇમ્પોર્ટન્ટ ટુ હેવ ધોઝ કાઇન્ડ ઓફ થિંગ્સ. અને રેગ્યુલર ચેકઅપ્સ બહુ જ અગત્યનું છે. મેડિકલ ચેકઅપ, ડેન્ટલ ચેકઅપ, ઓરલ હેલ્થ ખૂબ જ જરૂરી છે, અને મેન્ટલ હેલ્થ. અમે 10-12 વર્ષ પહેલાં અમારા હેલ્થ કેમ્પમાં કોઈ મેન્ટલ હેલ્થ સર્વિસીસ નથી. થેન્ક્સ ટુ પ્રોવાઇડર્સ લાઈક ડૉક્ટર મખીજા એન્ડ હિઝ ગ્રુપ કે અમારે મેન્ટલ હેલ્થ સર્વિસીસ પણ અમે આપીએ છીએ. તો આઈ થિંક ઇટ્સ અ કોમ્બિનેશન, મેડિકલ, oral and mental health is together. Thank you so much. So I'm going to give it back to Divyesh Bhai.
Yeah, thank you so much, Tushar Bhai, for very nicely coordinating and with all the doctors and handling very nicely, smoothly. And, like interaction, we love it actually, the way you interaction, like a question and answer things rather than just a speeches. Continuous, very nicely, all the doctors, thank you so much for providing very useful and informative information. એક મારી પર 2 question આવ્યા છે, તો I'm just reading the question and you can just answer it. After recovered from the COVID, why most people have the anxiety and the fatigue? Any doctors can give the answer.
Well, I mean, COVID was a experience of a lifetime for current generation, and I think you were 2 questions, right? Anxiety and what was the second one? Fatigue.
Fatigue, yeah.
Yeah, fatigue. I will let Dr. Shukla address that. But the anxiety is, we came out from a very tough period, and it was like we had to readjust to normal things in life all over again. Even like simple as going to the stores, we were nervous about, being reinfected. We still get this thought, when we go to a crowded place, because we still hear people getting COVID. I've had several friends who have had COVID recently. So
Yes.
that's a reality. And thank God that the new variant is not as virulent. Uh, so yes, it is common, and I think other things are that through the COVID, many people have lost loved ones. And not only that, the worse than losing a loved one is not having a closure. You cannot even attend your funeral, and you cannot even say goodbye. I mean, that's unfathomable for most of us, you know. So for
And I
fatigue, I will
think
let Dr. Shukla answer that.
Yeah, so a lot of folks have developed fatigue as a result of COVID. I think when the strain was stronger, a lot of people had developed long COVID symptoms, and there are symptoms that have extended over a period of time, and I think that's been a challenge for many people, especially with chronic medical conditions. And I think there's also been in the news where they talk about specialized clinics for long-term COVID symptoms, and that's really helped a lot of people get through the long-term side effects of the fatigue.
I can add a few more things, because મારી clinic COVID વખતે epicenter હતી US માં, and I treated more than probably 3,500 to 4,000 COVID positive patients.
Yeah, that's so true.
Okay, minimum. So what I looked at that, I will just give you the history. તો અમે લોકોએ માર્ચ 2020 પેશન્ટને ટ્રીટ કરવાના શરૂ કર્યા. પેશન્ટને અમે ઘરે મોકલ્યા, જે રિકવર થયા. મોટાભાગના 65 અને અપ હતા. તો એ જ્યારે હોસ્પિટલમાં એ દરમિયાન આવ્યા માર્ચમાં, out of 10 only 1 or 2 went home. 7 or 8 patients died in the hospital. 65 and up, very worse mortality. અને પછી જે લોકો ઘરે ગયા, તો 2 થી 3 મહિનાની અંદર કાં તો બ્લડ ક્લોટ લંગ્સમાં થયો હોય, બ્લડ ક્લોટ પગમાં થયો હોય. Then we realize કે કોવિડ થી આ લોકોને બ્લડ ક્લોટના પ્રોબ્લેમ થાય છે. એટલે by May and June અમને લોકોને રિયલાઇઝ થયું કે આ લોકોને બ્લડ ક્લોટના પ્રોબ્લેમ થાય. એટલે પછી અમે લોકોએ બ્લડ થિનર આપવાની શરૂ કરી. પછી ધીરે ધીરે સ્ટીરોઇડનું આવે. પણ બોટમ લાઈન એ છે કે 1 in 5 પેશન્ટ છે એને પોસ્ટ કોવિડ સિન્ડ્રોમ, એટલે એમના જે સિમ્ટમ્સ છે ને, ઇટ કેન ગો અપ ટુ ફ્યુ મોર યર્સ, લાઈક એન્ઝાઇટી, ડિપ્રેશન, વીકનેસ, ટાયર્ડનેસ, ઘણી વખત કોફ, lot of problems. અને એ પોસ્ટ કોવિડ સિન્ડ્રોમ, there is no treatment. It goes away by itself. The best thing is continue with the healthy diet, exercise, keep yourself busy. જે તમારી મેન્ટલ હેલ્થ અને એ બધું સારું હશે તો ઓટોમેટિકલી સારું થશે. બાકી એની કોઈ ટ્રીટમેન્ટ. એટલે હજી અમે લોકો જોઈએ છે અત્યારે પણ કે જે લોકોને 2020 2021 માં થયું છે, they still have some symptoms.
And I think this is going to stay couple of decades or more than that, I think, right? It's not going to go away completely.
We don't have any actually evidence-based medicine for this, unfortunately, કે ભાઈ કેટલું ચાલશે. But another thing અમે જોયું કે COVID પછી hair loss significant થાય છે.
So I think the plus point before 2 years and now is the death, right? COVID ઘણા લોકોને થાય છે, but not that death ratio is high, I believe. Maybe you can give us a better number, but that's what we see, right? Death is gonna very low death due to the COVID now. So that's the science developed, whatever the vaccine and the medicine that's helped us.
That is true.
So thank you so much, all the doctor. One more question. How about the eye surgery? Should do the far distance and near at the same time? There is one other question. The દૂરનું અને નજીકનું સર્જરી કરવાની આંખની, તો can we do at the same time?
Dr.
That's not my specialty.
Yeah,
I can just talk about from a personal experience because I had to make that decision when I went for my surgery. And yeah, so there's, I've heard, mixed views from people. So maybe there might be other experts here who might be able to answer that question.
Right. Yeah, this question is actually out of our topic, but there is a question, somebody who interested to listen the answer. So if any any doctor can have the idea.
Yeah. I think as far as the cataract surgery goes, people have their own preferences. Some people choose to go with one eye at a time. Same thing with the knee replacement. Some people go with the one replacement at a time. So I think it's a personal choice. There is no science behind either to get one or two together. So I think it's all personal preference and how they want to have their daily life going, because if they do cataract surgeries in both eyes, probably they will need some help from their relatives as well. So I think
Right.
that is a person. Yeah.
So medically, there is nothing restriction, right? You can do
No.
only once. You can do twice,
Yeah.
both together.
Yes,
In
absolutely.
India, મેં જોયું મારા ઘણા relative, they do, that they are, I think, used to do the both the leg surgery, means knee surgery at the same time.
Yeah.
And like it looks like, over there I see like a couple of my, the family, they did at the age of the 60, one of, my real cousin, they did both leg knee surgery at the same time.
Yeah.
And I heard another my family member, they did the same thing. So it looks like, here we are usually like her, like a one leg at a time, one knee surgery, and then after a couple of months we do the second surgery. So as you said, there is no such rules, but it depends on person to person is vary.
Yeah, it's a personal choice as well as how overall your health is. Okay, so if you have
Right.
many chronic diseases, you want to go one at a time. If you are very healthy, then you can go with bilateral. So
Right.
yeah.
Thank you so much, doctor. Very quick, is there anybody have any question? Please raise the hand. So, like, okay, Prakash bhai, go ahead. By the way, you see here everybody, in the screen.
Yeah.
Prakash bhai, Chirag bhai, they are all co-founder.
Thank you, the team. It's a wonderful presentations. I appreciate it highly, and I humbly request all of you, all the doctors panel, to attend the first convention we have, and you can give our mental strength stronger by your presence. So please do come. My question is, what is the role of sense of humor in mental and aging health?
Go ahead.
Sense of humor, what is the role?
So I actually think that's a great question. I use humor a lot when I work with people. And even for folks, again, that are going through like a number of challenges, I think that if we think about the brain and we talk about happiness, no one of us is feeling happy at all hours. And so I think humor actually plays a very critical role. I think sometimes as professionals, we think we need to present a certain way, but at the end of the day, we're all people. And I think humor can actually help to even de-escalate a situation. It can help with conflict. It can help to relate to people better. It makes us look like human. Other people feel like they're human. So I use it almost daily, multiple times a day. And I think that even in working with a number of types of adults and older adults, folks respond very well to that. So I just think that because of all the events that are happening in our world, the least that we can do is, inject some humor. And I think even in our brain, it releases, I imagine, certain chemicals for us to just say, it's going to be okay. I know there's one more question here that was asked. I'm just going to scroll up here. I think the question is, are there differences in healthy aging and coping with loss or stress between men and women? I think that's a really great question. I would say generation, I think it depends on the generation. And so I think for a lot of generations where men have a very typical role of perhaps being the breadwinner, depending on the generation again, and women had a typical role of being at home for certain older generations. that then can affect how they repurpose. And now, of course, with generations now, including my own, things have shifted significantly. So I think when it comes to healthy aging, it's finding again a new normal based on what norms are acceptable for you based on your generation. And so for men, that might look different. So if you're used to perhaps being very independent, and for some women, females now, for our generations and even younger, it's repurposing and finding something that aligns with your values, I think, regardless of your gender, which is important.
I just wanted to make one comment on the humor question that you had. I think it's a great coping strategy, and of course, you can never go wrong with a good joke. And as long as the humor is not at the expense of yourself and the other person, then I think it's good. It's also a sign of resilience.
Very good. Thank you. Moderator, what do you think about it? Dr. Patel?
Absolutely. You need to have some humor in your life. Otherwise, you will be stressed, depressed. So
life will be boring.
Yes, life will be boring. So keep it nice and light, whatever you do, but make sure that you don't offend other individuals. So I think that is the key.
Yeah. Thank you so much, Doctor. One more question from Prakash, go ahead.
No, but thanks. Thank you for answering questions.
Okay, there is one more question. I see the raised hand from the Maya Bhai. Rajesh Bhai, Dr. Rajesh Bhai, please, Rajesh Bhai, unmute karjo. Unmute yourself. Yeah, I send you the notification. You can just click OK. Unmute.
Okay. No, I just wanted to answer about the eye operation. It's always good to do one at a time, because one of my family member, and it does happen, is that when they call you on the first day for a checkup, that lens piece was still left behind. So you most likely don't want to do, you can do within a week's time or something like that, instead of doing both at the same time, especially when it comes to the eye surgery like cataract or anything like that.
Thank you.
Thank you. Let me see if anyone has any question or want to say anything about this seminar. Please raise the hand. Yeah, Dr. Vasudeva.
I just want to thank FOGA for this collaboration. I think it's been a great initiative. And I think Dr. Amisha gave you an idea for a new project earlier about the social interaction.
Yeah.
And we had an opportunity to recruit some people who would love to get engaged into the community and improve their mental health.
Thank you, Chirag.
Okay, thank you all.
Bhupesh Bhai, Dr. Vipul Bhai, he is also from here in New York. Vipul Bhai, you want to say anything?
This is really good initiative from the FOGA, from the medical point of view. Our lectures we just give one-sided. And this question answer is a good style of doing it. I think we should implement it, our Gujarati Samaj in New York. This is excellent.
Yeah, sure. Thank you. Thank you, Vipul Bhai.
Yeah, it's a very good seminar.
BEPS is one-sided. It's no fun. 102 temples, but it's just one-sided. This is very nice.
Yeah, Vipul Bhai and Himanshu Bhai, of course, they are our Gujarati Samaj of New York Health Committee. Vipul Bhai is much involved also in the BAPS. So BAPS ma ghana bada અહીંયા Long Island ma the health seminar થાય છે એમાં he is there. Anyone else? Bhupesh Bhai?
Yeah, it's a very good. Yeah, it's a very good seminar. All doctors gave us a very good insight, which, at least for myself, I didn't know much of the things. And we will continue like this kind of seminar, and I hope all these doctors can give the support like this, so that we can educate our community.
Thank you.
Thank you.
Thank you. Thank you, Bye.
I'm Dr. Manoj Desai. Hello, I'm Dr. Manoj Desai.
Yes, Manoj.
You, Tushar Bhai, and 3 physicians done a wonderful job. The topic which you have discussed, it really required this discussion, because lots of people are here becoming senior about 70, 75, going to 80, 85. And what they are supposed to do, though physicians know in between all the things, but to put together in 1 hour and give them total knowledge, it is a fantastic thing. So I know Kushan and all the physicians, congratulations and thanks, and to arrange many more health seminars like that. Thank you very much.
Thank you, Manoj Bhai. Thank you so much.
Dr. Rajesh Bhai Boluchu.
Yeah, Rajesh Bhai.
Last question, how come we see in the society when the loss of life between the husband and wife, the wife can take that situation much better compared to husband, and husband cannot tolerate that stress? Is there any explanation behind that? And it happens quite frequently, one has to go. So can you explain why the woman can take it easily rather than man?
I don't have a clear answer, but I think it depends on the individual resilience, and that will determine the ability to react appropriately and accept the changes and stressors. I've seen both ways. In some families, I've seen men deal with things better than women, and others, women deal with things better than men. So it'll be a nice thing to see if there's any research findings on that, whether one gender is predominantly better equipped at being more effective.
And also, it also depends on what kind of social support they have. That also definitely become influential in resilience as well. Yeah.
Is it true that man is more likely to get remarried when they're single compared to women? And I've seen so many instances that men have gone to India to find a woman, and compared to a woman getting alone. And I don't know what is it, because their hormones are still kicking and why the woman's hormones doesn't kick in after menopause. Is there any
to do with the hormones?
Women are stronger than men, basically.
I think we come from our culture where I think it is more acceptable for men to get remarried. Like if you recall, many years ago, growing up, when a woman loses her husband and she's a widow, she stays widow for lifetime. They never think about it's unthinkable of getting remarried. But now that is changing, thankfully. And for divorce also, I see women getting remarried and men, but it is still men tend to be more. I mean, we have a support group for divorced women actually at SAMHIN. And, for that reason, because it is very stressful and there's a lot of shame and stigma associated with that, especially for women. We provide that platform. But yes, there's no clear answers.
Rajesh bhai, man, I think, usually we are dependent on the woman, right? Basically, in a garma ek kasu kari na sake. When you don't have a woman, then you say, okay, maybe I'm not a doctor. I'm just
It's just general.
Giving you the general answer, what I think. But
Thank you.
Partly on the hormones also, but doesn't matter.
Nothing to do with the hormones.
No.
Thank you, Rajesh bhai. Thank you, Rajesh bhai.
Yeah.
Thank
All
you.
the speakers
Thank
were
you
very
for-
good,
Thank
we
you
loved
for-
it. Thank
and
you
the-
so much,
the
everybody.
whole session was very, very good, and I
Yeah.
liked.
Thank you.
Okay.
Thank you.
Thank you
just
so
want
much.
to add one more thing for all or for everybody. Always remember one number for any suicidal or crisis hotline. Anytime you go for any crisis, it's a 988. Just like you remember 911 for emergency, you can dial 988. It's a very confidential, but please, I hope that nobody has to call them. But if anything you feel, and always think about that, there is always solution for any problem. So
Yeah,
please.
it's 24/7. There are trained counselors for that. I'm glad you brought that up. And it's not just for people when they are facing suicide risk, even for other crises,
mental health crisis,
you can call. Yes.
I think it is important that people should realize બેમાંથી છેવટે એક જ જણને રહેવાનું છે. They are going to be either one, man or woman, and both of them should be ready for that. They should be really prepared and ready, have to have all knowledge. Sometimes it happens in a small town, wife doesn't know anything, what husband did, and they get lost when something happens. So people should be ready that બેમાંથી એક જ છેવટે રહેવાનું છે અને એ માટે બધાએ તૈયાર થઈને રહેવું પડે.
Thank you, Manoj.
Thank you.
Okay, so I think we conclude our meeting now, right? And once again, if you have to say anything, doctors. Otherwise, we can conclude.
No, thank you.
Thank you.
All right. So once again, thank you so much, all the participants, for joining FOGA USA the health seminar. As I said in that, if you want to, enroll like this kind of information or future seminar, તમે તમારો email તમારા chatમાં હજી પણ લખી શકો છો until we close it, and we will add your email in our distribution list, so you will receive the similar kind of all the health seminar in the future. Or કોઈ ઓર્ગેનાઇઝેશનમાં તમે કોઈ જગ્યાએ એફિલિએટેડ હો તો એ લોકોને કોન્ટેક્ટ કરી શકો જે ફોગાની જોડે અમારા કનેક્ટેડમાં છે. But once again, thank you so much, Himanshu bhai, our chair, health committee. Thank you so much, Dr. Tushar bhai, moderate for today's our whole and managing the whole, the concept very nicely, and all the doctors, Vasudev bhai, Ami doctor, and Dr. Nehal. Thank you so much once again. Good night, everyone.
Thank you. Good night.
Thank you.
Good night.
Thank you.
Night.